Alzheimer's disease and other dementias are devastating conditions that can affect individuals and their families in profound ways. While these conditions have a significant genetic component, the role of genetics in their development is complex and multifactorial. In this video, we will explore 10 helpful pieces of information about the role of genetics in Alzheimer's disease and other dementias. We will discuss the genes involved, the impact of lifestyle factors, the benefits and limitations of genetic testing, the importance of early diagnosis and intervention, and much more. By understanding the role of genetics in these conditions, we can take steps to reduce our risk, improve our health outcomes, and support those who are affected by these conditions. So, let's dive in and explore the fascinating world of genetics and dementia. 1. While we know that genetics plays a role in Alzheimer's disease and other dementias, the exact genes involved and how they interact with environmental factors are not fully understood. Scientists are working to identify the genes and pathways that contribute to these conditions, but the research is still ongoing. It's important to note that Alzheimer's disease and other dementias are complex and multifactorial conditions, with many different factors contributing to their development. So, while genetics is a significant component, lifestyle factors and other environmental factors are also important in reducing the risk of developing these conditions. 2. Mutations in genes such as the amyloid precursor protein, AP, and presenilin-1, PSEN1, can cause early-onset Alzheimer's disease, which typically develops before the age of 65. However, these mutations are rare and only account for a small percentage of Alzheimer's cases. Most cases of Alzheimer's disease are sporadic and have a later onset, meaning that they are not caused by specific genetic mutations. It's important to note that while these genetic mutations are rare, they can still have a significant impact on affected individuals and their families. Genetic testing can help identify individuals who are at risk of developing early-onset Alzheimer's disease, allowing for earlier diagnosis and treatment. 3. The apolipoprotein E, APOE, gene has been identified as a major genetic risk factor for late-onset Alzheimer's disease. People who inherit one copy of the APOE epsilon 4 variant have an increased risk of developing Alzheimer's disease, while those who inherit two copies have an even higher risk. However, it's important to note that not everyone who inherits the APOE epsilon 4 variant will develop Alzheimer's disease, and not everyone who develops Alzheimer's disease has the APOE epsilon 4 variant. Other factors, such as lifestyle and environmental factors, also play a role in the development of Alzheimer's disease. Genetic testing can help identify individuals who may be at higher risk of developing Alzheimer's disease, allowing for earlier intervention and treatment. However, it's important to remember that genetic testing has limitations and should always be accompanied by counseling and support. 4. While genetics can play a role in the development of Alzheimer's disease and other dementias, lifestyle factors such as diet, exercise, and social engagement are also important in reducing the risk of these conditions. A healthy diet that includes fruits, vegetables, whole grains, lean proteins, and healthy fats has been shown to reduce the risk of cognitive decline. Exercise, especially aerobic exercise, has also been shown to have cognitive benefits, such as improving memory and executive function. Social engagement and mental stimulation, such as participating in hobbies, socializing with friends and family, and challenging the brain with puzzles and games, can also help reduce the risk of cognitive decline. By taking steps to improve our lifestyle habits, we can reduce our risk of developing Alzheimer's disease and other dementias, regardless of our genetic risk. 5. Genetic testing can be helpful in identifying individuals who may be at an increased risk of developing Alzheimer's disease, but it's not recommended for everyone. The decision to undergo genetic testing should be made in consultation with a healthcare provider or genetic counselor who can provide information about the potential benefits and risks of testing, as well as the implications of the results. Genetic testing can have emotional and psychological consequences, and it's important to consider these factors before deciding to undergo testing. In addition, genetic testing is not a guarantee of developing Alzheimer's disease, and lifestyle and environmental factors also play a significant role in the development of the condition. Therefore, genetic testing should always be accompanied by counseling and support to help individuals make informed decisions and plan for the future. 6. Advances in genetic research have led to the development of new treatments for Alzheimer's disease and other dementias that target specific genes and biological pathways. For example, there are currently clinical trials underway for drugs that target amyloid beta, the protein that accumulates in the brains of individuals with Alzheimer's disease. Other drugs are being developed to target tau protein, another protein that is involved in the development of Alzheimer's disease. While these treatments hold promise, they are still in the early stages of development and more research is needed to determine their safety and effectiveness. In addition, it's important to remember that Alzheimer's disease and other dementias are complex conditions with many different factors contributing to their development, and it's likely that a combination of treatments will be needed to effectively treat these conditions. Therefore, ongoing research is critical to advancing our understanding of the genetics and biology of Alzheimer's disease and other dementias, and to developing more effective treatments for these conditions. 7. Genetic counseling can be a valuable resource for individuals and families who are concerned about their risk of developing Alzheimer's disease and other dementias. A genetic counselor can help individuals understand their family history and personal risk factors, explain the results of genetic testing, and provide information about the potential benefits and limitations of testing. They can also help individuals and families make informed decisions about their healthcare and future planning, including making decisions about treatment options, making lifestyle changes, and planning for the future. By providing education and support, genetic counseling can help individuals and families feel more empowered and informed about their genetic risk for Alzheimer's disease and other dementias. 8. Early diagnosis and intervention are crucial in managing Alzheimer's disease and other dementias. Genetic testing can be a useful tool in identifying individuals who are at an increased risk of developing these conditions, allowing for earlier diagnosis and treatment. Early intervention can help individuals and families better manage the symptoms of Alzheimer's disease and other dementias, and can also provide opportunities to participate in clinical trials and other research studies that may lead to more effective treatments. In addition, early diagnosis and intervention can help individuals and families plan for the future and make important decisions about their healthcare, finances, and living arrangements. Therefore, if you or a loved one is concerned about the risk of developing Alzheimer's disease or other dementias, it's important to talk to a healthcare provider or genetic counselor about the benefits and limitations of genetic testing, and to seek early diagnosis and intervention if appropriate. 9. Family history of Alzheimer's disease and other dementias is an important risk factor for these conditions. If you have a family member with Alzheimer's disease or another form of dementia, you may be at an increased risk of developing the condition yourself. It's important to talk to your healthcare provider about your family history and any concerns you may have about your risk. Your healthcare provider may recommend steps you can take to reduce your risk, such as maintaining a healthy lifestyle, staying mentally and socially active, and participating in regular cognitive assessments. They may also recommend genetic testing to help determine your risk level and inform your healthcare decisions. By staying informed and taking proactive steps to reduce your risk, you can help protect your brain health and reduce your risk of developing Alzheimer's disease or other dementias. 10. While genetics plays a role in Alzheimer's disease and other dementias, it's important to remember that these conditions are complex and multifactorial, with many different factors contributing to their development. In addition to genetics, environmental factors such as lifestyle, diet, physical activity, and social engagement can also play a role in the development of these conditions. Therefore, a holistic approach that considers both genetic and environmental factors is important in understanding and managing Alzheimer's disease and other dementias. By taking a comprehensive approach to brain health, individuals and healthcare providers can better understand the various factors that contribute to these conditions and develop effective strategies for prevention, early diagnosis, and treatment. In conclusion, while genetics plays a crucial role in Alzheimer's disease and other dementias, it is only one piece of the puzzle. By taking a holistic approach that considers genetic, lifestyle, and environmental factors, we can better understand and manage these conditions. If you or someone you know is affected by Alzheimer's disease or another dementia, know that you are not alone. There are resources available to help you and your loved ones navigate these challenges and live your best lives possible. Thank you for watching, and I hope this video has been informative and helpful. Don't forget to like and subscribe for more content on health and wellness.